Now we would like to welcome Samantha, our guest speaker, who is an assistant professor in the School of Urban and Regional Planning at Toronto Metropolitan University.
Thanks, Catherine. And thanks everybody at Urban Minds for having me today. So excited to be with you. And I'm really excited to have the chance to chat with folks who are in high school. When I registered for this, I wrote down my high school. I went to Notre Dame, which is in the east end of Toronto, very close to Scarborough, near Victoria Park Station. So yeah, I'm excited to be here. As folks said, I'm a professor in urban and regional planning. I'm also a registered professional planner, so I have the professional accreditation to be a planner. And I do research on how the places we live in affect our health and well-being. And specifically, I look at older adults, people living with dementia, and do a lot of work with folks with disabilities and thinking about access in that way. Can you folks see my slides okay? You're not seeing my notes by any chance? Okay, yep, fabulous. All right, so I wanted to start with this quote from one of my favorite scholars. Their name's Amy Hamraie, and they're based in the US. And so they say the design of buildings and public spaces is not value neutral and passive. Built environments serve as litmus tests of broader social exclusions. And basically what Dr. Hamraie is saying there is that the way we build spaces is not this neutral thing. People build spaces, and how people, their preconceptions, their assumptions about how people move, how bodies move through space, it shows up in our built environment. And so that's what they mean by litmus tests for broader social exclusion. And so more often than not, planners plan for people that look like them. And so for me, I think this is fundamentally due to a lack of understanding, awareness, or inclusion of different experiences by different folks. Things like ability, gender identity, ethnicity, race, socioeconomic status, age, religion, etc. And so how these social attitudes, they show up in the design of our communities. And it shows up in the kinds of investments we choose to make or not make, or did we build a bench here, or did we make the sidewalk wide enough? And so again, the places we live in are a reflection of our society. And since it's human beings who create cities, how we build them says a lot about what we value as a society. And of course, I've put all of your faces in front of my controls. Aha, there we go. Okay. So when I think about Dr. Hamraie's quote, I also think about how planners and city builders can move towards a more just and inclusive communities. And so we can sort of do this in three ways. The first way is outcomes. So did we build a ramp into the building? Did we build a bench for people to sit on? So that the things we physically build. We can also think about it as process. So who gets to access our planning process? Who gets a voice in what gets built in the park down the street? And then the third one is practice. So again, how do city builders think about folks who are different from them, and how do they engage with community? So what Dr. Hamraie was talking about was how cities are often built for this fake, what people may refer to as a normal body. And so when they say that, what they really mean is this white, male, cisgendered, 30-something person who's heterosexual, who's able-bodied, and who's middle class. And we all know that that doesn't represent all of us, right? We know that that doesn't exist, and that our bodies are all fluid, they change through time, and that there's no such thing as normal. All bodies are different, and that's a part of being human. And so as planners, as designers, we got to think of bodies as different, happening along this spectrum and changing over time. So disability, as defined by the World Health Organization, is defined as a part of being human. It's integral to our experiences. It often results from the interaction between a health condition like dementia or low vision or spinal cord injury and a range of environmental and personal factors. 1.3 billion people globally have disabilities. In Canada, it's a quarter of people in our country. And then 50% of all Canadians have experienced some form of disability have had a temporary disability like a broken arm, or they live with someone who has a disability. And so improved access not only helps people of all ages and abilities, but it also ensures that our friends and family members can be included in our communities. And so there's many different types of disabilities. There's things like physical disabilities or mobility related, the one we often think about, people who use wheelchairs or use a walker or a cane. Also sensorial disabilities, things like being blind, deaf, having hearing loss. They can be cognitive, like dementia. It can be neurodiversity, like autism. It can be mental health disabilities, like depression or anxiety. It can also be chronic health conditions, so things like Crohn's disease, which causes you to have to use the washroom a lot, and so public washroom access becomes so important. And then things like lupus, which can affect your immune system and make you really tired. And as a result, you need to rest more often while you're out places. And of course, as we age, we're way more likely to experience some form of disability. And as the World Health Organization says, people with disabilities have a right to the highest standard of health in their communities and a sense of inclusion as well. So what is disability? Accessibility? It's about ensuring that people can move around their communities without barriers and with ease. It can include the built environment, but it's also how we interact with people. Do we stigmatize them? Do we talk down to them? We got to think about that kind of stuff. It's about employment opportunities and access to social services. It's ramps, but it's also more than just ramps, which we're going to get into. And really importantly, we have to remember that barriers in our built environment are not the fault of the disabled person. They are the fault of our society for forgetting them in the design process. So some examples of accessible features are things like ramps that aren't too steep, accessible and gender neutral washrooms, benches that you can sit down on, as well as things like automatic and wide enough doors. I was just out with a participant living with dementia and he uses a walker. And so he was like, I love the Shoppers Drug Mart, but I literally can't go into any of the restaurants in my community because they all have a step. So when we think about accessibility legislation and how all of these things fit together on a policy level, we've got the Canadian Charter, Rights and Freedoms, which prohibits discrimination against people with disabilities, which is great. We've also got the Accessible Canada Act, came into being in 2019, so it's pretty new. And it's a really good start, but sadly, it only applies to federally owned buildings. So it means national parks and the Parliament buildings and other federal buildings, but it doesn't apply to places we live and go every single day. In Ontario, we have the Human Rights Code, which is again prohibiting discrimination. We've also got this AODA, Accessibility for Ontarians with Disabilities Act, that has a goal of making Ontario accessible by 2025. And it applies to our public and private spaces. They've got standards around the built environment, but often it's primarily targeted to people who use wheelchairs or mobility devices. And unfortunately, Ontario is not doing the greatest when it comes to actually making that goal of 2025. From a municipal perspective, there are accessibility guidelines, so things like how wide a sidewalk can be, how wide a doorway should be, how many washrooms, things like that. And we also have municipal accessibility advisory committees where disabled folks advise city staff about plans and policies and how they might impact folks with disabilities. Unfortunately, in planning, there's not a lot of discussion about disability. And so that's why I'm incredibly happy that you are here and you're interested in this topic. But when we talk to planners, there's not a lot out there, but all they want to do is learn more because that's what planners do. They want to make cities better for everyone. And so I think that's really, really key. So I want to take you through some examples and then we're going to watch some videos. And I want to show you a couple of examples of how we might make neighborhoods more inclusive to people living with dementia. So dementia is a cognitive disability, primarily affects older adults, and it involves things like short-term memory loss, long-term memory loss, getting lost in familiar places, issues with judgment, issues with communication as well. And so there are a lot of things we can do in how we build our cities to make them more accessible to someone who has dementia and enable them to get out and get involved in their communities just like everyone else. So the first thing is streetscape. You'll probably recognize streets like this. These are pictures from Kitchener-Waterloo. And there are these big wide roads, cars going super fast. And so for us, this might be uncomfortable to walk on, but for somebody living with dementia, this is a fence. This is a border. They do not cross this road. They may not even go to that road. And so it's something that's uncomfortable for us. It's so overwhelming that they are then forced to be in their smaller community. They don't pass that kind of a road. But when you look at the urban design of more residential areas, things like slower streets, slower cars, more space for sidewalks, space for buffer zones between a sidewalk and a car, quieter, more shade. People love those kinds of environments. They also liked mixed-use streets. Often mixed-use streets force cars to slow down. There's more things to look at as you're walking along. And this felt comfortable and safe for people with dementia. Got some examples of bad sidewalks here. So things like having stuff in the middle of the sidewalk. We're going to watch a video about how that's a problem for someone who's blind or low vision as well. And then this other sidewalk, you'll see it slants down on one side and there's no separation between the road and the sidewalk. And that slanting down can be a tripping hazard for an older adult, or like your mobility device might go on an angle, which can be a problem too. This is a better sidewalk, one that's separated, one where the sidewalk is up and flat. Again, that space, that feeling of safety, being away from the cars and having that shade access. Parking lots are a big one. This is a parking lot path to nowhere on the one side. Also for someone with dementia, they're more likely to be overwhelmed by noise and activity, or to be like if a sound's coming here, they might get more scared more easily. And so in a parking lot with cars coming in every direction, that can be really scary for someone with dementia. And so folks talked about not liking being in these kinds of parking lots. These are better parking lots. Not perfect. We don't want parking lots all the time, but sometimes we have to have them in our communities. And so again, having a raised sidewalk, having greenery nearby, all incredibly important and made people feel much more safe as they walk around. Another thing that I like to highlight is the use of signage, because we know that's really important in our communities, figuring out where you are. This sign is a good sign, but the problem is that GO train symbol, the green, what looks like a G and an O, is only knowable to people from Ontario and knowable to people who use GO train frequently. So a lot of my participants looked at this sign and they said, what is that saying, right? And so folks have talked about, instead of using icons, suggesting that we use photos, like using photos of the place that we're pointing to, so that not only folks with dementia, but perhaps folks who don't speak the language might be better able to figure out where they're going. And so using that actual photo of what you're supposed to see when you get there could be a different way of looking at signage. Another thing people living with dementia talked about was the use of trail systems. So this is a trail behind people's homes. And why they loved trail systems, this is so interesting, is that there were less opportunities to mess up. So you enter the trail at one point and you're waiting for your exit. There's not a lot of opportunities to make decisions. And so for some folks, that made them feel safer because all they had to remember was one turn versus multiple turns for instance. And they got to be in nature. For people living with dementia, again, a cognitive disability that affects spatial navigation, we want to think about, what does wayfinding mean? How do people know where they go? And so to think about landmarks and how we think about how you know how to get to school, right? School is a place that means something to you, like a destination. You may turn right as you exit your house because there's a store there, that's your cue to turn. Maybe you can see your school from farther away, so you know you're going in the right direction. Or maybe you grew up near the lake like I did, and I always knew the lake was south, and that's how I oriented myself. I also invite anyone, if you have questions or you think of something later, or like you're like, oh, that's kind of cool, and you want to reach out and chat a little bit more about it or about going to planning school even, feel free to send me an email. My email is available online at the School of Urban and Regional Planning website. And I'm a huge nerd and love to talk planning. So everything's about planning, really. So yeah, happy to do that. Ooh, how do we address the issue with the bike lane in the video? Great question, Ryan. Unfortunately, it's already built, right? I mean, I think for me, what I probably would have said was to put some kind of a curb cut there so that there was an obvious edge or like an actual line of planters, right? So to think about like what Mr. Apostle is talking about was that shorelining piece. And so how could you have some kind of consistent shorelining or separation in between the bike lane and the sidewalk? Like on Danforth, we have, in most of it, there's like planters, right? Along that edge. So it's good for shorelining, but also good for the bicycle to know that somebody's not going to come walking into the bike lane, I think. Yeah. Unfortunately, I can only see myself because of the spotlight, but I'm just going to remove that so I can see everybody else's face. Yeah. But I think like planters would probably be the easiest thing, right? Because they're probably not going to lower the bike lane. Just from a pure like I think cost perspective, probably easier to put in like some sort of separation or maybe bollards or something like that. Mr. Epoxy, if you care to go look on the internet, has some really great videos where he goes into brand new university buildings, including the Student Living Center at TMU. And he is like, this was built with public money, and yet it's very inaccessible to him as a person who's blind. And it's really eye-opening to watch, right? Excuse the pun.
Okay, so I think if you have any questions to Samantha, please message to her at the end of this webinar. So we'll move on to the next section.
Okay, so a reminder for this webinar, you can actually receive 1 volunteer hour for attending. So please email your volunteer form to hello@urbanminds.co before May 15th, which is 1 week from now, and to have your form signed. So now about some upcoming events. So our next and last webinar for our 2023 to 2024 program year is on parks and recreation. And this webinar will take place on June 5th from 7:30 to 8:30 p.m. And the guest speaker is Army, who is an active transportation coordinator in the town of Ajax. And Army challenges misconceptions about who can benefit from walking, biking, and rolling. And she believes that active transportation should be safe and practical for everybody. So, if you haven't already, make sure to check out our social media, and our TikTok and Instagram is at OneUpToronto. And we also have our website and our email listed in the slide. And we also have a Discord channel that you can join to stay up to date with all our events. So, if Daphne has figured out like the results of the trivia game, I could pass it back.
Yeah.
To her.
So we got with 4 out of 5, we have Addison, and then 4 out of 5, Angela and Brian coming in third.
Congratulations. We'll probably send you an email about and message you about which gift card you will be receiving or which one you will be choosing. So thank you for joining us for our 9th webinar, and have a good evening.